Hello, everybody. Thanks so much for taking time in your day to be here with us. My name is Amy Van Ness, excuse me, and I will be your host and moderator for this session. I'd like to begin by acknowledging the land on which McMaster University is located, which is the traditional territory of the Haudenosaunee and Anishinaabe nations, and within the lands protected by the Dish with One Spoon Wampum Belt. That wampum uses the symbolism of a dish to represent the territory and one spoon to represent that the people are to share the resources of the land and only take what they need. We seek a new relationship with the original peoples of this land, one based in honor and deep respect. May we be guided by love and right action as we transform our personal and institutional relationships with our Indigenous friends and neighbors. It is in this same spirit that I welcome all of you to our second of 3 town halls. Today's event is focused on the impact of healthcare providers' role in their families and relationships during the pandemic. This event is supported by the Public Health Agency of Canada as part of their work to address PTSD and trauma in those most affected by COVID-19. In this town hall, we will be discussing examples of healthcare providers who have experienced moral distress, moral injury, and other challenges in their work life and home life during the pandemic. There will be moments that may be disturbing to you, and it's totally fine if you wish to excuse yourself from this event at any point. So, excuse me. So over the past 2.5 years, we've heard so much about the strain on the healthcare system and on healthcare providers due to the pandemic. And we owe a debt of gratitude to all the physicians, nurses, therapists, personal support workers, and public safety personnel who, despite facing incredible challenges in their daily work lives, still found time and courage to talk to us and share their experiences. This research project seeks to shine a light on the impact that the pandemic has had on the mental health of all those healthcare providers who have given so much of themselves to the service of others and continue to do so. The evidence-based resources and tools we are offering to help build mental health literacy, support, and resiliency are our healthcare salute, our way of saying thank you so much for your service. One more thing before we get started. I just wanted to let you know that there will be plenty of time for our speakers to answer your questions after the main presentation. So if you'd like to submit a question, please use Zoom's Q&A function, and you can find that in the control panel just below this video. And to begin our program today, we're going to watch a pre-recorded presentation by Kim Ritchie and Emily Sulo. In the talk, they'll be diving into some findings from their research about the effect of COVID-19 on healthcare providers' relationships. So Dr. Kim Ritchie is a postdoctoral research fellow in the Department of Psychiatry and Behavioral Neurosciences here at McMaster. She holds a PhD in rehabilitation science from Queen's University and is a registered nurse with extensive clinical experience in mental health, geriatric mental health, and professional practice. As I mentioned before, Kim is involved in this research project that's meant to develop an understanding of the unique and shared lived experiences and psychological impacts among healthcare providers resulting from their work during the pandemic. This research will contribute to the development of novel approaches to address the needs of healthcare providers and public safety personnel. We also have with us today Emily Sulo. Emily is a graduate of the University of Toronto's Honours Psychology program and Western University's Master of Management of Applied Science in Global Health Systems. She has been involved in the field of mental health for several years, working on evidence and community-based projects, including the development of mobile health units in rural settings. As a research assistant in the Trauma and Recovery Lab at McMaster, Emily has primarily been involved in the development of knowledge translation deliverables to disseminate research findings focused on understanding the experience of healthcare workers and public safety personnel during the pandemic. Thank you both so much for contributing to the discussion today, and I think we're ready to take a peek at the recording.
Hello and welcome to our second town hall presentation. Today, we're going to be talking about the impact of the healthcare provider's role on their family in interpersonal relationships. My name is Kim Ritchie, and I'm here today with Emily Sulo, and we are both very pleased to present some of our preliminary research findings. As we know, COVID-19 has impacted all of our lives in so many different ways. But for healthcare providers, they faced additional impacts, specifically because of their role and being on the front line of the pandemic, serving the public over the past 2 years. For example, healthcare providers have had significant changes in the way they work, including changes to their role, to policies, and to clinical protocols that they follow. Many healthcare providers have worked significantly more hours, and some with reduced staffing levels which has really contributed towards feeling exhausted and some towards burnout. Healthcare providers have also had a lot of fear and uncertainty surrounding the increased level of contracting and transmitting COVID due to the higher exposures they face in the course of their work. And on top of all of these challenges, there was this extra layer of stress related to their role and the impact it had on their own relationships with their family, friends, and their colleagues. During the pandemic, we've been conducting interviews with healthcare providers from across Canada in order to understand the impact of COVID-19 on their mental health. As part of these interviews, we've also asked healthcare providers about the impact of their role on their relationships with family, friends, and colleagues. Today, we'll share some of those results from interviews that we conducted between February 2021 and January 2022. For the first theme, healthcare providers told us that during their pandemic, they felt like their work extended beyond them and had a significant impact on their family. There was a fear of exposing their families to COVID because of their higher workplace exposure to the virus. And they were also working more hours to accommodate increased number of people who required healthcare, which meant certain adjustments had to be made within the family. Many healthcare providers described having to physically distance for periods of time from family and friends throughout the pandemic. While this occurred primarily in the first wave of the pandemic, it also occurred periodically throughout the remaining time of the pandemic due to high exposure at work from increased hospital admission or community transmission. And the main reason for this physical distancing was to protect their family and friends from COVID-19, as they felt they were a higher risk through their work. And there was a variety of ways that they physically distanced, as described from the quote on the screen. Some moved out of their house into hotels at their own expense, into rented trailers, and some lived in their own cars. Others isolated themselves to a specific area or room within their own house. And during these periods, most did not eat, sleep, hug, or interact with their families, often for many weeks or even months for periods of time. This also applied to extended families, where healthcare providers physically distanced by not attending traditional family gatherings, such as birthdays and weddings, even though they may have occurred without them. Other healthcare providers were excluded from these events because the family was fearful due to their role as a healthcare provider. And in response to physically distancing, some healthcare providers tried to stay connected through alternative means, such as virtual calls, social media, or even a telephone call. And some of these changes were felt to be beneficial by healthcare workers to maintain these relationships, and others indicated that it really just made them feel more isolated because it didn't seem to be the same as an in-person visit or gathering. And the other way it was impacted is that family members had to take on new roles to accommodate increased work hours or different schedules, and also to accommodate periods where the healthcare workers just felt too exhausted and burnt out to be able to fulfill usual roles in parenting or even in household chores. And this is explained in the quote above, where this healthcare provider's husband had to take on additional parental responsibilities at home to accommodate work scheduling. But being able to accomplish these usual home responsibilities was described by the healthcare providers as they felt very guilty because of it, and like they had even lost their place within the family for even a period of time. And then once their work hours reduced, or they no longer had to physically distance, there was this period of having to adjust again and even renegotiate some of these roles within the family.
Another major theme healthcare providers described was this overarching feeling of never ending caregiving that became all consuming during the pandemic. On the one hand, due to the demands of the pandemic placed on healthcare providers, they worked more hours and experienced pressure to place work before their family or themselves. This problem existed before the pandemic, but was exacerbated by it due to the added challenges in the workplace, such as worsened staffing issues. And on the other hand, typical familial caregiving responsibilities became more difficult to execute due to the added risk placed on vulnerable groups during this time, which led to at-home caregiving feeling like an extension of their occupational role. And this just made it very difficult to escape from these overwhelming demands. When looking at the increased pressure to prioritize work over family, healthcare providers describe two main sources of this pressure. The first being organizations putting additional pressure on healthcare providers to work more often, stay overtime, come in on days off, and are even denying vacation time because staff shortages have been exacerbated since the beginning of the pandemic. In order to meet the care demand of the pandemic, healthcare providers are needing to make up for these gaps. However, the healthcare provider themselves also put pressure on themselves to work these extra hours out of a sense of duty and guilt towards the public and colleagues. Healthcare providers experience a contradictory pressure as well from family to reduce their work hours. So, for example, some healthcare providers stated that their families wanted them to quit their jobs, but many healthcare providers said that they were continuing to work despite these pressures because they believe it is necessary to continue in order to maintain the healthcare system at this time. And these pressures create internal tension for healthcare providers because they're feeling guilty towards colleagues for not taking on additional shifts. And some of these healthcare providers left their position or made a complete role switch because of the toll it had on their physical, emotional, and mental health. Many of these individuals felt it was the only way for them to balance work and family by finding a new role. However, it was made clear that this was not an option for everyone, and so those individuals were stuck in a difficult situation. The role of caregiver outside of the workplace was also not a new responsibility specific to the pandemic. However, due to the high risk that COVID posed to vulnerable loved ones, such as children and the elderly, health-related care needs of family members and friends fell to healthcare providers with the expectation that they would be able to make the best care decisions for their loved ones. And this added responsibility and pressure to their caregiving role at home created a double burden of family and work caregiving. And because of this, caregiving provided outside of the workplace became an extension of their professional role and contributed to the exhaustion and stress that many healthcare providers are facing during the pandemic. The challenges and stressors associated with the healthcare provider role during the pandemic also produced a disconnect between personal life and work life, such that many healthcare providers felt as though they were living in two worlds that they were unable to reconcile. These two worlds that we identified are being described as home world and work world in this presentation. So one of the major relationship impacts that has come out of this theme of living in two worlds is an increased connection with colleagues. And this is due primarily to two reasons. The first is that colleagues provide effective social support. So there's been a change in work relationships where healthcare providers are turning more frequently to colleagues for social support because of their shared experiences during COVID. Other healthcare providers are able to understand and empathize with the challenges that they are being exposed to and are therefore able to provide much needed and effective support. Additionally, work exposures have led to a greater collective identity with other healthcare providers who have similar experiences. And the other reason is the risk of infection. Many healthcare providers feel a sense of reassurance by interacting more with other healthcare providers because they did not feel they were putting them at any increased risk of exposure, as everyone is vaccinated and has similar levels of work-related exposure already. At the same time, healthcare providers told us that they were feeling disconnected from family and friends. So due to healthcare providers' exposure to challenging situations at work, they're having a difficult time relating to family and friends and vice versa, which has made this more difficult for healthcare providers to turn to family and friends for support. There's also the additional fear of sharing these experiences with family in case it traumatizes them, which produces further barriers for communication between the two. And the lockdown restrictions limited healthcare providers' exposure to family and friends, contributing to this gap between healthcare providers and loved ones. There's also been increased conflict reported amongst family and friends due to differing opinions on vaccinations, masks, government rules, etc., leading to many healthcare providers cutting off or limiting relationships for their own mental health. So just to go over some of the key findings, the role of healthcare providers have impacted home life during the pandemic, specifically due to physical distancing requirements and a need for role changes. The increased caregiving demands of a healthcare provider at home and work during the pandemic felt all-consuming and contributed to additional stress and exhaustion on healthcare providers. The numerous work-related challenges healthcare providers face during the pandemic have led to them feeling as though they are living in two worlds that they're unable to reconcile, specifically the work world and the home world. With that, I would like to thank you all for your time today and also thank our valued healthcare providers who have and continue to serve on the front lines of the pandemic. Thank you all very much.
Thank you for sharing your research, Kim and Emily. We really appreciate it. So we're going to move into the live discussion portion of our event today. This is a chance to really get into the nitty-gritty and understand the complexities and nuances of today's topic. We're going to jump right in with a few questions, but it's not too late to ask yours. If you have a question of your own, all you have to do is pop it in the chat or the Q&A box and I'll get to it. I'd like to welcome to the live discussion today, Margaret McKinnon, Heidi Cram, Kelly Hassel, Kim Ritchie, and Emily Sulo. I was hoping each of you could take a moment to introduce yourselves and tell us a little bit about your involvement in the project or, through what lens you're answering the questions from today. And Margaret, I was hoping we could start with you and perhaps you could pass it to the next person.
Thank you so much, Amy. So my name is Margaret McKinnon. I'm a clinical psychologist, and I also serve as a professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster. I was incredibly privileged throughout the pandemic to provide mental health supports to healthcare workers. So being on the COVID unit, being on the ICU units, and also leading communities of practice for healthcare workers. And I will say, without any reservation, that I heard repeatedly about the impact of pandemic service by healthcare workers on their relationships with families. And I'm really pleased that we have the opportunity to highlight this impact because I think sometimes it's missed when we talk about the impact that this pandemic has had on those who serve, including healthcare workers, but also public safety personnel and their families who really gave service as well and sacrificed during the pandemic. Maybe I'll turn it over now to Kelly to introduce herself.
Good morning, everybody. My name is Kelly Hassel. I'm the clinical resource leader of respiratory therapy here at St. Joseph's Healthcare in Hamilton. I'm coming at this from the lens of a respiratory therapist that has been in acute care in the front lines, and I had an opportunity to work with respiratory therapists throughout Ontario and Canada throughout the various phases of the pandemic. I'm also a mother of two children who have gone from ages 5 to 8, and they're now turning, one was 5 at the start and was now 8, and the other one was is now 11. So I've had that opportunity as well. And then we were very fortunate to be linked with Margaret and her team very early on in the pandemic to discuss the concept of moral injury within respiratory therapists, because this was something that had not been really addressed very much to date. So we've been very, very fortunate to have that assistance throughout this time. Maybe I'll switch it over to Kim Ritchie now, if I may.
Thank you so much, Kelly. So it's my pleasure to be here. I think Amy so kindly introduced us at the beginning too, but I'll just add my role for the project has been, I guess, mostly lead for the project in terms of the research part. And I've had the privilege of talking to over 100 healthcare providers since the beginning of the pandemic and through each wave. And so we've really really value all the information that's been shared with us, but the impact on the family was one of the really early themes that arose and has remained consistent. And it really brings home the fact that, you know, we all belong to greater than our work, and that if things are going on at work, it impacts our family. And I think the pandemic really had a profound impact on healthcare providers and by extension to their family because of the types of service that they had and the amount of work that they actually had to do in terms of hours during the pandemic and serving. So we're really happy to be here today in order to highlight this for the rest of everyone else. And I'll pass it over to Heidi.
Hi, I'm Heidi Cram. I'm an occupational therapist by training, but primarily I've been a researcher around families across populations that really experience occupational risk and requirement. And that's what we've been trying to reframe through the research group I'm leading, the Families Matter research group, and really trying to understand the dimensions of lifestyle that come with certain kinds of jobs. And so when we think of military, we think about public safety personnel. We've been building a whole way of understanding the impacts of families with that lens of occupational risk and requirement, because we could see how it extends into the healthcare worker field and how much there's blurring of these kinds of experiences and how much we can learn. I will say I was absolutely struck by the findings and how much they represent the ongoing experience in so many ways of the families of public safety personnel. All of those things become quite amplified and quite explicit and undeniable, quite in your face through the risks of it, but also the countermeasures and the impact that that's had on the day-to-day functioning of the family, especially during longer periods of, say, lockdown. So I've got many, many thoughts. Fantastic presentation, so interesting. Thank you.
Emily.
Yes, thank you. Hi all, I'm Emily Sulo and I'm honored to be here today. I'm a research assistant in the Trauma and Recovery Lab at McMaster, and I'm coming from this as being involved in the project, mostly through creating knowledge translation materials that are presenting our findings to the public to spread awareness about what healthcare providers and public safety personnel have been experiencing during the pandemic. But I also have been working alongside the team on the research portion of the project. And it's great to be here today. Thank you.
Thank you, everyone. So I want to just jump right into it. So it was mentioned in the presentation that some healthcare workers felt they've lost their place in the family because they weren't able to do normal household duties, or what was normal before the pandemic household duties. Ashley in the chat actually beat me to connecting, making the link between healthcare providers during the pandemic and military families. So Heidi, I know you've done extensive research with military professionals about life after service. So what I'm wondering is, can families truly go back to how it was pre-pandemic? And if they can, what is it that they can do to begin rebuilding?
Thanks for your question. And I mean, I don't think any of us can go back to life truly pre-pandemic. So I don't really think it's an option. I think that many things have evolved and changed. And one of the things that we've learned, and it's been so interesting when we think about these occupational risks and requirements in relation to military families, and then in relation to public safety personnel, is there are some differences. When you work in communities where you live, it does change the experience of you in your home and your connection to your community. One of the biggest pressors for public safety personnel and for healthcare workers are things like shift work. And the shift work means that you have to do pretty persistent, ongoing transitions in and out of home and work. And so we hear, and we've heard in your findings, that there's the maintenance of these two selves, that for you to be adaptive in one context, you may not be able to be that same self and adaptive in the same. And how do you rapidly transition back and forth? So when we we look at military families and how military families adapt to changes in roles, rhythms, and routines when their family members are away for extended periods. Public safety families, healthcare workers do not have that time press in the same kind of way. They have rapid in-out transitions. This can be extraordinarily draining on both sides because essentially, and as a fire spouse, I can speak to this as a very long-term experience with this. How do you actually, and as an occupational therapist, I find it fascinating around roles, rhythms, routines, connection, time use, all of these things. How do you simultaneously say, while you're not here, we function this way and we're capable and competent, and we don't need you because we can't need you because we have to structure it a way that is. But then as soon as you come back in, we have to recombobulate and now be able to do that. And so this plays out in families in different kinds of ways, depending upon, say, if you have young children, if you have elder care, if you have a spouse with a career that competes for kind of resource and time and flexibility, you see how much those lifestyle strains can really play out. So I think one of the biggest strains is the transitions in and out.
Yeah.
Margaret.
Oh, yeah. Margaret, I see your hands up.
Oh, sorry. I just saw her hand. I'm just answering hands now. Sorry, Amy.
No, Heidi, I just want to say, I have the privilege of, I'm the Homewood Chair in Mental Health and Trauma, and have the privilege of working with the Guardians program at Homewood. And that is one of the things we hear consistently from public safety personnel is that transition from being at a call, being in a difficult situation, driving home. And the second that you open that door, you suddenly have to be a father, a mother, a spouse. When you've just left, for example, an accident that's been horrific and seen children who have been injured or children who have been killed. And when I was on the units during the pandemic, one of those powerful things that I could say to healthcare workers was that I understand that you're living in a different world right now. And you could just see people, how they react to that. And then to follow up with that by saying, I know that you're living in a different world than your family, than your friends, and then people who are not healthcare providers, and your life experience is different. What you're seeing is different. It's very hard for other people to know or understand. For example, proning an older adult, where it takes 8 people to turn over an older adult. And that may be very painful for the older adult when that's happening, where it may be the case that, that older adult has said, I don't want further care, but families understandably wanting to hold on to hope are saying, I want my mom or my dad to be treated. So I really feel that belief as well, that if healthcare workers tell their stories, which Emily was talking about, that they may traumatize their family members at home. And so they live, and we hear that from public safety personnel all the time on the units at Homewood and in our research, that, if I tell my story, I'm going to hurt somebody by telling it. And so you see people cleaving on to other healthcare workers as a way of being able to tell and share their stories. They are family, much like in public safety personnel and in the military. Those who you serve with are also your family. And the word family in the professions in which we serve, means those by whom you're related by blood or by adoption, but also those people with whom you serve. I know, Kelly, if you have thoughts about that, based on your own experience. I know you've done a lot of work around this with your colleagues in respiratory therapy.
Yeah, I'm sorry, just because could you just reframe exactly what the question is that you wanted me to address, just because I'm all over the map now.
Yeah, no, thank you. Yeah, I know that we've talked about respiratory therapists. I've seen how your profession holds together as a family. There's the impact on your family at home, and then there's the impact on your family at work as well. And I don't know, do you have any thoughts about how the pandemic impacted on that?
Yeah, I think it's interesting because we do work as an interprofessional team. So we do move throughout the organization and we do work with all the different teams. But we all come back to our home base, and this is where we have our safe space where we discuss and talk about all the challenges that we're having. And I think that also ties into your commitment, because you don't want to let your family down, and you know how hard it is if you're not going into work the next day. And at the beginning of the pandemic, there was a stigma that if you ended up with COVID and couldn't come in to help out your team, it's because you did something wrong.
Yeah, I remember. Yeah.
And you knew that dread and that cycle, and thinking about, I know for me, for example, if I was going to let one of my children go somewhere or have someone come in to help, what were the risks that I was putting on my family? What were the risks I was technically putting on my team?
Mm-hmm.
And so that sense there of that commitment sort of is very unique. And then my spouse, for example, is not in healthcare. So completely different context. And how much do you share? Do you not share? And how do you make them understand that potential commitment that you feel to this group of people that are being paid to be there like you are?
Absolutely. We would hear often from healthcare workers that, even to take a break on the unit, so to take 15 or 20 minutes for yourself meant letting down the team, or to go home and not take another shift, or to not come in the next day when you were exhausted. It felt like letting your family down. At the same time, in going home to your family, your nuclear family, saying, there's nothing left. I have nothing left at this point. I can't be a mom right now to my 2-year-old child. I can't right now go home and be a partner because I have given everything that I have on this unit, and not wanting to let that family, that work family down.
So Margaret, I'm curious what sort of strategies healthcare providers can use both at home and at work. So I was hoping maybe you could speak to some strategies they could use at work, and perhaps Kelly, maybe you have some tips on how they might be able to cope at home with that sort of 24/7 demand for caregiving.
I think one thing that we would say, and it's a very old adage, but it's a true one, is that we're not able to help others until we put the oxygen mask on ourselves, right? And that sometimes we just need to hear that, right? We need to hear that we deserve to be taken care of. We deserve to have a break, and taking that time, having self-compassion, which is very, very hard because so many people are relying on you as a healthcare worker. It's patients, it's your colleague, it's your family. And just keeping in mind that without taking the time for yourself to have a break, to heal, you won't be able to care for others in the most optimal way. And that's one really important thing for us to remember as healthcare workers, to remember that we're deserving of the very best, that we have brought Canadians through to what we hope will soon be the other side of this pandemic, that we've had the opportunity to serve, and that reinforces our identity as healthcare workers. Many of us got into these professions, whether we be as clinicians, now as researchers. We came here to serve. And what we did do during this pandemic was serve. I work a lot like Heidi with the military and Kim. And there's a way that we honor the military. We say, we salute you. We thank you for your service. And to healthcare workers, we say the same thing. We salute you. We thank you for your service. And, of course, for some people, it will reach the point where, this is really starting the mental health impact of the pandemic is impacting, your daily activities. It's impacting your mental health to the level that you're experiencing distress. And it's very important to also seek out resources, mental health resources, again, knowing that you deserve that care. And so we have a series of resources here, but the first place to really start, if you're feeling that, this is causing you a great deal of distress, is impacting your daily life, is to reach out to your family physician, to book that appointment, to seek help. They'll be able to refer you on to sources in your community of support to help you out themselves and really support you. So that's also another important lifeline for healthcare workers, and really important to reach out. Kim and Heidi and others, and Kelly, I don't know what your thoughts are around, and Emily talks about other ways that people can cope, but I did want to highlight reaching out for those mental health resources where needed. Heidi.
I think one of the things that we can see and we can learn from the work around these transitions with other populations is that when people come home and they may have nothing left in the tank, they may feel like empty shells, and they're expected to just kind of transition in, is that before there's that kind of, and often, I mean, we're well far into it now, so there's no before, but thinking that there often needs to be a transitional allowance for that individual. So rather than come in and have, here's the updates on everything with the kids, you need to do this, and the handover, because especially when there's shifts, there's a baton that goes between people who are living in the home. So now I did my thing, I'm going to work, you do this thing. So recognizing that for you to be able to effectively, it's not a decompress, it's almost like a recompress. Like there's a recombobulation piece here where people need to find a way through whatever strategy to be less deplenished. So that replenishment is so important, right? But they're not going to get it if when they come in the house, there's another set of expectations and they have to do that mental shift. People talk about the drive is very helpful to do that transition and to think about what are the things that you do in that transition. It might be that you use that 20 minutes in the car, that hour in the car, to actually listen to something that takes your mind completely out of work and resets you. It might be something that you do that's more meditative or gratitude based or whatever works for you as a person. And that there's also an agreement when you come home that there's a transitional plan. So it might be if you've had a really hard day, there's something at the door that you pick up so that your spouse or partner recognizes not now. And not now does not mean it's you. So because it's so easy to interpret that kind of difficulty as behavioral, relational, and interpersonal, and that just makes things worse after all. So where are there, like, just if I pick up the pink thing, that means I need 15 minutes. I'm going in and going into the bathroom, closing the door. I need some quiet time. Nobody, just give me 15 minutes. But those strategies need to be talked about. And healthcare workers, in a very giving way, are not giving to self. So that self-compassion that Margaret, it's like first responders or public safety community, they're happy to help somebody else, but accepting help and seeing that for them to give help to others, they have to help self is such a mind warping concept that doesn't feel possible, but it's beyond foundationally required. Without that, they just continue to be like Humpty Dumpty versions of themselves.
Yeah. And how you think about the impact of trauma and stress on the body. And so, some of this is in our heads, but some of it is also in our bodies, right? So how do we give our bodies that space to calm down, to lower the arousal, to be present in the moment? And I'm thinking as you're talking about this transitional period of, for example, sitting in a soft chair, feeling the chair around you, putting your feet on the ground, feeling that sensation of the feet that are on the ground, holding onto an object, like a stress ball even, where you're holding it and paying attention and moving it and allowing both your mind to calm down, but also your body to calm down at the same time. I think that's excellent advice, Heidi. Thank you.
And sometimes it's when you come home, the first thing you do is take the dog out for a 15-minute walk. And then you have the pet, you have the nature, you have the physical activity, and you have also a routine way to then switch.
Yeah.
Because otherwise it becomes quite too much. And that plays out in the family in all kinds of ways that aren't positive for either the worker or the family members.
Kim, did you have something to add? I see you've unmuted yourself.
Yeah, thank you. One of the things that we've had quite a few healthcare providers tell us over the last number of months is having somebody just to check on them, just to ask them how they're doing, and to go past kind of that surface answer of everything's fine, and then to really and authentically want to engage into a discussion with them, like, how are you really doing? Like, I'm here to listen to you. And whether that person is a family member, a friend, a colleague, a manager, supervisor, like just creating that space of knowing that you have somebody to go to, that somebody you can really talk to and receive support, be heard first, and have that space and then receive their support. We've heard that's been invaluable. So a lot of people who have that have created these sort of support little groups. So they know they have somebody to go to when they need to talk, but that's not everybody, of course. And so I think one of the other things in terms of recommendations is to find ways to reach out to healthcare providers, whether you're a family member or, in a workplace. How can we help support that and create those safe groups to support each other?
Excellent, thank you.
I had one more comment too, Amy.
Yeah.
Right. One thing that we've certainly heard in the research that Kim's been leading is that we hear this from public safety personnel, from military members as well. Often people are looking for coping resources when they go home. And so those coping resources can take very healthy forms, and they can sometimes take on unhealthy forms as well. So increased use of alcohol, for example, which is we're hearing a lot about that in the research that we're doing, particularly among healthcare workers. And just being aware of and sensitive to knowing, have I increased the number of drinks I'm having after work? Is it having an impact on my relationships? Is it having an impact on me? I think being aware of that is really important, because unfortunately, people often want to numb out and not be present. It's a way of escaping inescapable stress. And so can we find healthy coping mechanisms to help take the place of some of those more unhealthy coping mechanisms that can creep in during stressful periods like this? And again, when that is becoming problematic, not feeling shame and reaching out for help. It is actually, in fact, very courageous and brave to seek out the help that you need. And you're setting a beautiful example for your children and for others when you seek out help for your mental health concerns, including addiction. That is true bravery and courage.
We have another audience question that I would love to direct to Emily. And the question comes from Ashley. And it is, I know you mentioned there were tensions around views and values related to vaccination and public safety measures within families. What kind of impact did this politicization of pandemic measures have on healthcare workers? They say that there's thinking specifically of protests outside hospitals, as well as the outpouring of support for healthcare workers.
Yeah, it's a great question. And so we already kind of covered that in the presentation when talking about how the political views were a major contributor to this distancing between healthcare workers and their loved ones, because it just created extra tension within those relationships that made it difficult for healthcare providers to interact with them. And so they felt the need to kind of create these barriers of these boundaries on conversations, or to just restrict relationships altogether. But we did, through this analysis on family and relationships, we started looking at a little bit about what healthcare providers were saying with their relationship to the greater public, and how they're feeling with the media, the government, et cetera, kind of those larger relationships. And one of the biggest things that kind of came out of that, or comments that came out of that, were feeling like they had to shoulder the blame of these mandates and restrictions that are being placed. So not just with the public, but also direct comments from loved ones, as well as, putting that blame on the healthcare providers when they really didn't have so much say in what was being put in place. And so there was a lot of hurt and confusion, especially with that, outpouring of support for healthcare providers at the beginning of the pandemic, where everyone's saying they're heroes and celebrating their role and contributions to the community. But then the shift kind of later into the pandemic towards, you're causing this, and having those protests outside of hospitals where that support kind of disappeared. And the other comments that we kind of heard about were that they're carrying the burden of maintaining safety within the community. So they went to extremes to ensure that they're taking care of their loved ones, restricting their interactions with others, so that they weren't putting them at exposed risk, because extra risk because of the risk associated with their role. But as everyone else kind of once the restrictions were lifted, were able to continue maybe going out and felt a little bit more comfortable having those social interactions again, healthcare providers were struggling to find out how to do that within their own homes as well, without putting their loved ones at risk. And this is all kind of compounded then by the media, and feeling like they're being misunderstood, or maybe misrepresented, or not being represented very well in the media. And so it's just difficult for family, friends, and the public to then relate to what they're going through. And so it's just all these compounding factors coming together to create this distancing and that two worlds kind of disconnect.
Yeah, absolutely. And Heidi, did you want to add to that?
Absolutely, because from the family's perspective, this we know from the different sectors, and we've done 4 different syntheses on trying to understand the experiences and the impacts of the families across sectors. And one of the things that comes out really plainly is this construct of identities is very complex. And there is a social kind of conference of expectations, responsibility, and blame on the families. And so sometimes that can be like a positive social capital, and sometimes that can actually be quite negative, aggressive, antagonistic. And what it does is takes families who are already kind of out of sync with the kind of 9 to 5 folk because of the nature of shift work often. And it certainly through COVID, through the extreme workloads for healthcare workers. So they're already feeling that out of sync. And then we've heard families talk about feeling like they're pariahs, and that they become kind of an extension of risk. So it's a very fascinating concept to try to get our heads around. And it's so important because, one of the things that we know is protective for people is social support. And social support where you really feel like someone's got your back. Not like if you feel like you go to the supermarket and someone accosts you because your spouse is a healthcare worker and you have a different set of rules and expectations that everybody else is free from. So there's so many layers. And so to Margaret's point about, there's so many similarities around this from military, veteran, public safety. And one of the things that we've come to really see is that families are serving alongside and taking up all these consequences. And if we want people who are in these jobs with high risk and requirements to be retained, we have to support the families, not only to support that person, but also to support themselves, because families matter in their own right. And we need that explicit attention. Thank you.
Yeah, Heidi, I couldn't agree more. And, our own research suggests that 1 in 2 Canadian healthcare workers are considering leaving their clinical positions right now. And that tells us we know about staffing shortages. We know that we don't sometimes even have ambulances to send right now. And we really need to hold on to this vital workforce that just underpins our society. Heidi and I were at an event last week, and the speaker opened by saying, we as Canadians, we just always knew that somebody was coming, that the ambulance was coming, or that the hospital doors were open, and that we went to ER, we would be taken care of. And we're in a situation right now that is perilous across the country. This simply is not the case in some parts of Canada. It's not, right? Yeah. Including in our capital, where the paramedic service has gone to code 0, which means there are no ambulances to send. And so we really do need to do everything we can to support this workforce. I would also say, the term hero has been very, very difficult. For some people, that's a very painful term to hear. And I think as Canadians, we need to be cautious in how we use that term, because hero assumes things about people that they don't necessarily want to hear about themselves. And so I just always say in using the word hero to be cautious in how we use that, and to recognize bravery and service, but maybe sometimes to not use that word that can be very difficult for some people to hear.
And Margaret, I'm just wondering, we have, I would like to be conscious of time, but perhaps if we could take sort of 2 minutes to address this question that's come up more than once in the chat. And it's sort of, to me, it's the elephant in the room, which is a lot of these issues are actually at a systems level. And I'm just going to read one of the participants' questions because I feel they framed it perfectly, which is they require a systems level response, not an individual response, right? So by telling individuals their only action is to work on things at an individual level, it feels like it's putting the responsibility on them for larger systemic failures. And I'm just wondering if you could speak to that a little bit. What can healthcare institutions do to begin to relieve some of this pressure that they're feeling?
I'm going to make one quick comment. I'm going to turn it over to Kim because I know she has a lot of experience around this and the work that she's been leading. Oftentimes when we talk about the mental health impacts of the pandemic on healthcare workers, what we talk a lot about is the levels of PTSD, depression, anxiety, increased use of alcohol, and so on. And that can be very shaming for healthcare workers because it's really saying you as an individual have developed a mental health condition. And some people will feel as if, I'm weak, other people didn't experience this. Why have I experienced this? And as you say, it ignores those broader system levels issues, which have given rise to increases in PTSD and depression and anxiety and alcohol use among healthcare workers. And we really, as the audience members have said, we need to focus on those system levels issues. And we have to be very cautious when we talk about mental health impacts of the pandemic at the individual level, because again, it ignores those broader system issues that have led to, in many instances, this rise in mental health conditions. And I'll just turn it over to Kim, because I know, again, Kim, you have a lot of experience around this and hearing
Thanks,
the
Margaret.
voices of healthcare workers.
Yeah, I appreciate the question because this has really emerged as one of the biggest things that we've learned through the course of our research. And, as we said, we've had a lot of interviews and everybody pretty much has spoken to this same thing. And what we've heard is that healthcare workers, they really feel that a lot of the things that may have worked prior, so self-help through various means of things for themselves, such as meditation that may have been given through a program at work, or some of the types of pizza parties and stuff like that were always really sort of well received, but that isn't enough, and that's not helping right now. And so they're really looking to have the next level, to have the things reconstructed at the systems level and at the organization level, and that the organization takes on the added responsibility for caring for their employees' mental health and prioritizing it even, so that healthcare providers, they put their patients first before themselves. They put their families before themselves, and they don't think of themselves. And so when we talk to them about self-compassion, you can see it's uncomfortable for them. But, we talk about how important it is. But what they really want is to have that caring come from the organizations, so that the organizations have the structures embedded within it to care for them. And the ways that they're saying that they would feel cared for is by having a lot more mental health support. So for example, having somebody they could call who is a formal mental health support on the units or in the building, so that they can go there during the course of their work and just sit down and talk with someone, so that they're not having to make time in their home time to talk to someone, or through additional expenses and so on. They want somebody readily available. And I think we really have a responsibility to recognize that healthcare providers, similar to military and public safety, as we've said, their jobs themselves take a toll on their mental health. So there is a responsibility now to recognize that at a systems level, it's not put the responsibility on the person. It's the responsibility of the system. Margaret?
Yeah, I'll just very quickly jump in. I will say one lesson that we learned certainly at St. Joseph's Healthcare in Hamilton and at St. Mary's Hospital in Kitchener is that having mental health supports directly on the units is very valuable. Sometimes healthcare workers don't have time to go to the library. They don't have time to go downstairs. At one point I sat in the storage room when nurses and other healthcare workers on the unit changed their masks because it was the only time they had to talk to someone about the difficulties that they were facing, the mental health difficulties. I was there for nearly 36 hours with those individuals. And so having mental health supports directly on the units, sometimes it's as simple as going and sitting at the nursing station and just saying, I'm here. I recognize you're living in a different world. I'm here to talk to you. And that maybe just be a 2-minute or 5-minute conversation, but it's helpful to know that the organization cares and that there's somebody right there on the unit for them in the moment to support them, wherever that may be.
Yeah, absolutely. So with that, I'm conscious of time, so I am going to end the panel discussion. Thank you so much to all the panelists. That was so insightful. I personally approached today's topic from a learner's perspective. So I'm not a healthcare provider or a researcher in this field. I have family who are, but I thank you so much today, panelists and presenters. This town hall really helped me begin to put myself in healthcare providers' shoes and understand more what they've gone through. And I think that's just all what we need a little more of right now is empathy, right? So thank you so much. And with that, I would love to pass the mic to Margaret for our closing remarks.
Amy. I just want to end on a very positive note in thanking healthcare workers for their service. We salute you, we thank you, we recognize the impact on your life and on the lives of your family. And we know you and your families have made tremendous sacrifices during this pandemic. And we just want to continue to honor you, as we know all Canadians do, and to thank you for your service.